Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs. Welcome everyone to today's program, Sleep and Cancer from A to Z. I am Katie Armsby, the Program Outreach Director with Cancer Support Community Atlanta. If this is your first time joining us for a Cancer Support Community Atlanta program, we welcome you and invite you to visit our website, CSC Atlanta, where you can see a complete list of both the virtual and in-person programs that we're offering. We have a great selection of programs that are starting to be offered in person, so we do invite you to check out our calendar so you can come visit us at the Centerpoint offices. We have nutrition programs that are offered monthly with an oncology dietitian. We have some really great stress reduction programs like yoga and Tai Chi. We have education programs like these, and of course support groups that are led by licensed mental health professionals. So again, I'm going to direct you guys to our website, cscatlanta.org, where you can see a complete list of the programs offered. And if you ever miss a live event, you can click that video tab on our website and you'll see a complete list of past programs, which does include Dr. Rossrucker's past programs. So we're happy to have her back. I do want to introduce today's presenter, Stephanie Hyatt. Dr. Rossrucker, do you mind going forward a couple slides?
Oh, sorry about that.
Okay. I will remind everyone you'll be on mute for the duration of today's program. We do invite you to enter questions into the program chat box that Stephanie and Dr. Rossrucker will address at the end of the program during the Q&A. So Stephanie was born and raised in Woodstock, Georgia. She graduated magna cum laude from Coles College of Business at Kennesaw State University. Stephanie is also a registered polysomnographic technologist and has worked in the sleep disorders field since 2005. She's been the marketing specialist for Northside Hospital's Sleep Disorders program since March of 2019. She lives in Adairsville with her husband, Johnny. She enjoys Tennessee football, we won't hold it against her, hunting, and mostly spending time with her 5-year-old niece, Lydia. So welcome, Stephanie, and I will pass it off to you to begin today's presentation.
Thank you, Katie. I really appreciate it. Dr. Jill Rossrucker is a board-certified physician in internal medicine, sleep medicine, as well as pulmonary and critical care medicine. She has over 2 decades of practice experience. She joined Medical Associates of North Georgia in 2005 and also serves as a medical director at our Northside Hospital Cherokee Sleep Disorder Center. Her passion is working to bring community awareness to the diagnosis and treatment of sleep disorders and sleep-disordered breathing, which is under-recognized and undertreated. As a side note, I have worked closely with Dr. Rossrucker for almost 4 years now. It has been a pleasure getting to know her and seeing how much she cares for her patients. When treating a patient, she takes the patient as a whole into account, not just their pulmonary and sleep concerns. We've done many events together, and I'm looking forward to hearing what she has to say today. Dr. Rossrucker, I'll let you have the floor.
Thanks so much, Steph, and have much enjoyed working with you as well, and John. Okay, so a little bit about myself. As they said, I practice pulmonary and sleep medicine at Medical Associates of North Georgia, which is right across from the old hospital on 320 Hospital Road. I am all outpatient, so I am able to see patients pretty much at a drop of a hat and work people in, but my passion is really about sleep medicine. I won't go into my training, but it's been varied in multiple places around the country, but I have been here for the past 18 years and have enjoyed it immensely. So we're going to have a very informal discussion about sleep in general, as well later as how cancer, whether it's diagnosis, treatment, recovery, and cure, how sleep is affected by all of the various facets of those stages of cancer. So we'll go first to the importance of sleep. You know, the 3 pillars of health are adequate restorative sleep, a nutritional plan that is along a normal weight, void of sugar, low in carbohydrate and higher in protein, and lower in fat for the vast majority of people, and some form of regular exercise, even one 30-minute period 4 or 5 times a week, even just walking. Those 3 things are very, very important. And if you do those 3 things, you tend to have lower stress, which is another factor. So we'll talk about the importance of sleep in general and how the body restores during the sleep period and how that factors into all of your organ systems working effectively. So again, sleep plays a vital role in good health and general well-being. We know if people are sleep deprived or have fragmented sleep or non-restorative sleep, they don't tend to be in a great mood. I know I'm not in a good mood when I don't get enough sleep. When you have adequate sleep, you just make better decision making rather, and problem solving. That's been proven. Most important for the cancer patient and anyone who deals with illness in general, especially inflammatory illness, your immune system works so much better when you have had restorative sleep, adequate restorative sleep. Your blood sugars tend to be lower, your appetite, not so much appetite, but what you crave to eat is improved when you are restored in sleep. We have shown in medical residents a long time ago that sleep deprivation makes them crave bad foods, sugary foods, salty foods. So your desire to eat better is improved when you have adequate restorative sleep. So how frequent is sleep disturbance? Well, the general population has sleep disturbance sometime in their life, at least 30 to 50% of people. With cancer patients, much more common for the various reasons we will go into, but up to 75% of cancer patients report trouble sleeping, moderately to severely concerned with their sleep problems, about 50%. And about 20% report a worse quality of life, specifically related to their lack of sleep, not the other factors involved in cancer diagnosis, treatment, and recovery. So first, you have to look at your sleep and try to identify, well, where is the problem? Is it that I'm having trouble falling asleep? Is it having fragmented sleep? Fall asleep fine, but then you wake up several times during the night and have difficulty falling back asleep. And the reason for that is that as we build up our homeostatic need for sleep during the day, and then we go to sleep, when you wake up at 2, 3 in the morning, you've already had some sleep. So it's obviously going to be more difficult to get back into a deep sleep. And we'll talk about ways of managing that. Often people will nap during the day and they don't realize that that is going to take away from their homeostatic need for sleep at night. So when people are having sleep onset insomnia or sleep maintenance insomnia, we really try to work with them on not napping during the day because that will disturb their nighttime sleep for the vast majority of people. Sometimes people have difficulty concentrating. They wake up too early in the morning and then have trouble going back to sleep. So then they're going to want to nap during the day, and that just kind of perpetuates the difficulty with sleep. Of course, sleep disordered breathing, if someone has snoring, gasping during the night, any witnessed apnea, obviously that needs to be addressed in a cancer patient or not. And we know that lack of sleep, which we define as less than 6 hours, or too much sleep, which we define as more than 10 hours, is associated with poorer medical outcomes. So we do want people not to be sleep deprived, and we don't want them to sleep excessively, being in the bed too long or sleeping more than 10 hours. So how does cancer impact sleep, specifically to the cancer patient? Let's talk about those factors. So cancer patients almost universally complain of fatigue, not necessarily sleepiness, but of profound fatigue, and there's multiple reasons for that. They often will have an irregular sleep-wake cycle instead of one consolidated sleep period, which is ideal. They will have irregular sleep-wake cycle for various reasons. It may be for pain, it may be for anxiety or depression, it may be stress, it may be related to medications that are involved in the treatment of their cancer, and they may have difficulty falling or staying asleep, as we've discussed. So we're going to talk about the various factors involved in cancer treatment that affect sleep. First, we'll talk about treatment and medication side effects, followed by hospital stays and what's involved in sleep disruption there. We all know the hospital is not where you get good sleep. Pain factors, fatigue factors, and then mental health factors, stress, anxiety, and depression. So treatment side effects and medication side effects are almost universal. The main medications that most people will relate impact their sleep are steroids, and often people do receive steroids with their chemotherapy. Radiation chemotherapy in and of itself, causes fatigue for many people and tiredness. Depending on your type of cancer diagnosed, you may be dealing with hormonal manipulations in your management, which have effects. Then, of course, you're dealing with actual surgery for your treatment and the pain associated with that. Radiation therapy is another factor, and the fatigue that comes along with that for many people. And many people obviously develop problems with anemia during their treatment period. And that, of course, factors into low energy for many people. The medications that are used to treat pain and nausea, obviously the pain medications can cause fatigue and sedation, and the same with anti-nausea medication. So all of these things factor into why the patient with cancer has difficulty with their sleep. Let's talk about the hospital. Hopefully, in this day and age, compared to hospital stays a decade or two ago, is less frequent in the cancer patient. It used to be very frequent from side effects of chemotherapy, but that is now much rarer. But should you find yourself in the hospital for any complication or treatment related situation to your cancer, you want to prepare for what that's going to be like and try to prepare to make the experience as beneficial as possible. Bring your items from home that make you comfortable. You can use your own pillow, your own pajamas, your own blankets, whatever makes you comfortable. Maybe having things in your room that remind you of your family and friends. We want people in the hospital, especially for any length of time, to keep their blinds open during the day. Try to get out of bed and not be laying in the bed. Get up to the chair. If you're able to walk, walk the halls as frequently as possible. And if you are having trouble and trying not to nap, obviously that's why we want you to be out of the bed. Light is a powerful wake stimulus, so we want the blinds to be open. Getting the medication that you need for your pain management to be administered during the day, or any other pain medications that you need. And then to follow good sleeping habits, even when you're in the hospital. And that means trying to have a consistent bedtime and a consistent wake time. And you can ask your physician to write an order that says, do not wake this patient for vital signs or for anything during the sleep period that's not absolutely necessary. And they can write those orders, and the nurses can follow those orders. So what about pain in the cancer patient? Very common, and either related to the primary cancer itself or from surgery that may have had to be done, treatment side effects and procedures that can be painful, anticipation of having to have various procedures done. All of these things are very important in the management of sleep. So we want to do whatever we can to minimize pain, especially during sleep. So there you go to your physician, let them know what kind of pain you're having, and try to get a treatment regimen that doesn't sedate you during the day if at all possible, but manages your pain at night. And that might be as simple as Tylenol, nonsteroidals, narcotics, local pain management measures with topical patches and those kinds of things. So pain may prevent you from falling asleep to start, in which you would want to manage that with some type of pain medication 30 minutes prior to going to bed. It may wake you up in the middle of the night, and you may need to take short-acting pain medications to be able to get back to sleep. And just basically discussing with your physician and your health care team to minimize pain, because pain, even for a non-cancer patient, pain is a very common cause of frequent wakenings in the night and difficulty falling back asleep. So again, talking to your doctor is very important in how to determine how effectively to manage your pain before it causes significant sleep issues. Fatigue, as I said earlier, is almost universal in cancer patients, especially during treatment. And it's generally their primary complaint is that they just don't have the energy to do anything or the mood to do anything. So the degree of fatigue varies with the treatment and the patient and their overall personality and those kinds of things. So 50% of patients report they were moderately to severely concerned with sleep problems. The majority, I think it's more than 4 out of 10, but the majority of people indicate fatigue symptoms are worse than the national average. So why do people experience fatigue? There's a multitude of reasons, and that's why it's almost universal. It may be the actual nature of your cancer. It almost universally is cancer treatment during any cancer active treatment. We mentioned anemia that can cause fatigue and low energy and sometimes shortness of breath. And nowadays we don't transfuse people unless the anemia is quite severe. So most patients will have to run during their treatment with some degree of anemia. We've talked about pain and how that causes fatigue. The emotional stress of being diagnosed with cancer, going through cancer treatment, anticipation of the future and where you will be, and all the emotions that go along with a diagnosis of cancer. The lack of sleep causes fatigue, and we've mentioned the reasons for lack of sleep. Poor nutrition, maybe because of side effects of chemotherapy, also cause fatigue. You may not feel like eating or may not be eating the best foods that would give you energy. Medications, various medications from not only the specific cancer treatment medications, but steroids, pain medications, and whatnot. Lack of exercise actually contributes to fatigue. We do want people to exercise if at all possible, even a small amount during the day. Take a walk, conserve your energy for doing productive exercise. And that makes a world of difference. We don't want people exercising in the hours before sleep, but in the morning or midday is optimal for that. And then as we've talked about, depending on the type of cancer you have, you may have hormonal therapy or hormonal avoidance that can contribute to fatigue. So a couple of tips to minimize fatigue: conserve your energy. Don't go around trying to clean this or clean that. Maintain your energy by exercising, even going on walks, get moving. Again, the more you lay in bed, the more you sit around in a chair, the more that immobility and inactivity promote further inactivity and immobility. So sometimes you just have to force yourself to go on that walk with a friend or a family member that can, give you encouragement and get you in a better mood instead of just being alone in your bed or in your chair. They talked about the various relaxation techniques that are available to you through the cancer support group. I would very much recommend that you take advantage of all the different resources that the Atlanta Cancer community has to offer. And then keep track of how you're feeling and when you're not feeling your best, and try to look at the factors as to what might be contributing that, to be able to discuss that with your healthcare team and try to minimize those events. So mental health is a factor in people's sleep, whether you have cancer or not, but certainly in a patient diagnosed with cancer and undergoing treatment, universally there is, stress, anxiety, depression, concern, not only for themselves, but perhaps for family members, and the caregivers of family members also experience these difficulties, causing insomnia and other sleep problems that can impact your emotional well-being the next day. So sleep deprivation, as I said, causes difficulty even in normal people. When I say normal, I mean non-cancer patients. So trying to overcome any factors that are contributing to sleep onset or sleep maintenance insomnia are very, very important. And again, no surprise to anyone, anxiety is almost universal, reported in 50% of patients, as well as depression in up to 40%. So these things need to be discussed with your provider so that they can be addressed, because we do have adequate therapeutics to manage these symptoms while you're experiencing them during your cancer treatment. So just acknowledging your mental health changes is the first step to treating them and causing them to be not as much of a factor in your sleep period and in your sleep quality. It's important to talk to your healthcare provider and your team about your symptoms so that you can get the help you need. Only 20% of people have actually discussed this with their healthcare provider, and we are there for that purpose. So please, track your symptoms. And when you have an appointment with your caregiver, make sure to bring those issues up so that they can be addressed. Some people will do journaling, to help them identify, what they're feeling, when they're feeling a certain way, what things are surrounding those emotions, and what can be done to improve that. So optimizing your sleep practice is important for all people. Sleep tends to be the first thing that people think is not important in their life, but it's actually probably the most important factor in a person's overall well-being, whether they have an underlying diagnosis of cancer or not. And let's talk about how to do that. So your sleep hygiene is composed of, we use the term sleep hygiene to talk about your environmental factors of sleep and your social factors of sleep. So let's go into what that means. So sleep hygiene is composed of several different things, and sleep doctors always review these issues with a patient. We want your sleep schedule to be consistent and regular. Your body operates on a very complicated circadian rhythm. And if your sleep schedule is kind of all over the map and you go to bed at different times, wake up at different times, take naps at different times, your body really doesn't know what it's supposed to be doing, and it just perpetuates the issues regarding difficulty with sleep onset and sleep maintenance. So we want someone to have at least as best as able, a set bedtime and a set wake time. Now, sometimes that is not possible because of pain issues and having to get up and move and those kinds of things. But to the best of the ability, set up a regular sleep routine, follow a nightly routine before bath. It might, I'm a bad bed of me looking at the bathtub. It might be taking a bath. It might be, having some relaxation reading time in a different room reading something that you're really not interested in, so that you're promoting wanting just to get in your sleep position and go to sleep and allow your mind to rest. I call it blocking your brain. You know, you take that hour before sleep and you read in a different room, something you're not interested in, practicing blocking your brain, not letting other thoughts or concerns in, so that you allow your body to kind of wind down, just trying to think, I just want to get in my bed, in my sleep position, and drift off to sleep, thinking about something neutral like clouds or waves. Those are the general teachings. As far as the bedroom itself, the room should be cool, dark, and quiet. There should be no light, no animals if at all possible, no food, no drink, no electronics, no clock. We don't want people looking at a clock and going, oh my gosh, it's been 30 minutes, it's been 60 minutes. So if you need a clock to wake up in the morning, which you should set a routine wake time, it should be turned away in the bathroom, so that if you get up and go to the bathroom, you're not knowing what time it is. I use the example with my patients that if I wake up to go to the bathroom at 5 o'clock and I know my alarm's going to go off at 6, I'm never going to go back to sleep. So it's really, really important not to be a clock watcher and not to know what time it is when there's an issue with sleep. My room myself, I have blackout drapes, I have a sound machine, I have an eye mask, I have earplugs, I have 3 pillows, the stars kind of have to be aligned for me to go to sleep. And but the basics of cool, dark, quiet are very important. And again, setting up a sleep schedule, we've already spoken of this. Have a fixed wake up time. Don't just, sleep until 8 or until noon, or again, that messes up your circadian rhythm and it perpetuates sleep issues. If your current sleep situation is kind of all fragmented and, messed up kind of thing, make gradual adjustments. You're not going to fix a fragmented sleep pattern overnight. What I tell people is that we're looking to make gradual improvements. Okay. And in my opinion, once sleep has been an issue in your life, it generally is always going to be somewhat of an issue. So we're looking to make gradual improvements in your overall quality of sleep. And people have to prioritize their sleep. Again, I said that most of America, cuts that pillar of health out sooner than they cut other things out. So you have to prioritize your sleep, especially when you're going through cancer treatment. You probably need more sleep than in general for your body to restore and recoup and fight, the disease that you're fighting. And again, people are tempted to nap during the day, but that really does affect nighttime sleep. And so minimizing napping, if at all possible, is recommended. So again, a consistent routine, budgeting time for winding down. Again, the hour before sleep, trying to be in a different room. The dimming of your lights after sun goes down is critical. We weren't meant to be looking at our laptops and our phones and getting on Facebook and whatnot, various social media things in the evening. That really promotes difficulty with sleep. So dimming your lights in your home. If you are going to read in very dim light in another room, so that you don't associate reading with being in bed. We want the bed to be associated with sleep only. Again, no electronics. If you are in the bed after you felt like you could go to sleep, and for whatever reason you're not asleep within 30 minutes or so, you don't know it's been 30 minutes because you don't have a clock. You're supposed to get up and go into a different room in an uncomfortable chair and read something very boring, blocking your brain, trying to promote, I just want to go back to bed. All the while you don't know what time it is. Okay. So if you don't get a good night's sleep on one particular night, I promise you will build up the homeostatic need for sleep, and the next night, third night, etc., is generally going to be improved. And again, if you have pain issues, you want to take this 30 minutes to an hour before you go to bed. Cultivating healthy habits. We all are probably guilty of, oh, I've got to get this done. I got to get this done before I go to bed. And then we kind of miss that sleepy window, so to speak. And then you're up until, 12, 2 in the morning and you can't go to sleep. So try to recognize your body's signals about, okay, it's time to go to bed. I can do this later. Okay. Again, staying active during the day as much as possible to promote building that homeostatic need for sleep. Create a routine for daily activities is very healthy for anyone. I try to get people to eat at the same time, exercise at the same time, eat the same types of food, throughout the day, creating as much of a routine in every way possible as you can. It creates your body will then come to expect those things and makes sleeping much improved. Reduce, obviously, caffeine and alcohol consumption in the evening. Don't eat and drink before bed. Usually try to cut off eating and drinking after 6 o'clock at night. Trying to exercise somewhat. I know that's difficult for a cancer patient, but even just going on a 30-minute walk during the day, maybe even a couple of times a day, is important. And again, we don't want people in the bed not sleeping. We want to promote the association of bed with sleep, just like with a baby. We don't want them playing in the bed, and we don't want adults in the bed unless they're attempting to sleep. So if you're going to read, if you're going to be on your phone, if you're going to do any of these other kinds of things, we don't want that to be done in the bed. Do it in another room. And if you are going to do those things in the evening, make it as dim light as possible. So again, in your bedroom, you want to have your mattress be comfortable. We all seek that perfect mattress, which I don't know if it exists, but and pillows are real important, at least for me. I have to have a certain type of pillow, and everyone's different along that, hard, soft, whatever. Cool temperature is very, very important. For me, for anyone, actually, I actually have a portable air conditioner in my window right by my bed. So having cool temperature is very important. It helps your body kind of, calm down. No light. Again, blackout drapes are key. Even the light of a phone charging, I can see that through my mask. So please keep all your electronics out of the bedroom. And then noise, of course. I already wake up enough on my own, as do cancer patients for various reasons they have. So you don't want other noises to be affecting you. If your spouse is snoring, and that's causing a problem, maybe temporarily you have to sleep in another room or get that person to fix that problem, whatever that repair situation might be. If you have somebody in your bedroom that has sleep apnea, let them get treated. But it's very, very important not to wake up because of noises that are preventable. You're already going to wake up for other internal reasons. So you want to minimize any noise. So what about the mental state that contributes to sleep disturbance? We've already talked about anxiety, depression, fear, things like that, and relaxation techniques that are available through the support center. So talking to your healthcare team about all of these issues that you may be experiencing is crucial, because if they don't know, they can't help you. So always write your questions down, write your concerns down before you go to your caregiver, and be sure that they don't rush you in and out of the room, that you have these bullet points that I want to go over, doctor, or if it's a other caregiver, and make sure they address those issues, because it's your health, it's your fight, and you want to be in a situation where your body can optimally fight the disease you're fighting and win. So again, many cancer patients report sleep problems in the prior month, but only 17% communicated those problems to their doctors. So speak up so you can get help. And identify exactly what they can help you with, okay? Why am I having trouble sleeping? What steps can I maybe do to improve that? Should I see a counselor or join a support group about my mental concerns that I'm dealing with, okay? would a sleep aid be appropriate for me? And very often it is in a patient undergoing cancer treatment with all the side effects of medications and whatnot. So all of these things can be addressed with your provider. Seek counseling if you need to. They have group supports, but you can also identify a personal counselor to help you with whatever mental situations you're going through. We talked about relaxation therapy, mindfulness therapy, and then sleep aids being prescriptions. So again, the resources that we have talked about, I'll hand this on back. Is Stephanie there?
Yes, ma'am.
Okay.
All right. Just a side note about Northside Sleep Centers. We have 5 locations in Metro Atlanta. We have Canton, Cumming, Roswell, Sandy Springs, and Gainesville. And we have a network of over 15 sleep physicians across those locations that are part of our sleep program. And it is a program, they're not independent labs, everybody works together. And our sleep centers offer in-lab testing, home sleep testing, CPAP setups and supplies, as well as daytime studies, delayed phase studies, everything. We did build our sleep centers around a Marriott hotel feel so that our patients are as comfortable as possible with breakfast in bed options, personal thermostats for climate control, big screen TVs. They do have to be turned off when we go to bed, Wi-Fi, and sleep number beds. So if you or someone you know is suffering from a sleep problem, please come see Dr. Rossrucker or one of our many sleep physicians. And there are several questions, Dr. Rossrucker. The first one is it possible or beneficial to try and catch up on sleep?
So yes, it's possible. Is it beneficial? Yes. Is it ideal? No. Okay. Having said that, all my work life, I probably have been sleep deprived, previously being on call in the ICU and all of those kinds of things. Sometimes you just can't get adequate restorative sleep in a single sleep period. So I definitely do catch up on sleep on the days that I'm not working. Is that the ideal situation? Probably not, but and sometimes it's just absolutely the only way that a person can get the adequate number of hours they need. And this is true of cancer patients. It's true of all people, depending on their social situation. Sometimes they just can't get 8 hours in one concise sleep period. The reason one concise sleep period is always ideal is because our sleep rhythm, our stages of sleep, we tend to get our deep restorative sleep later in the sleep period. So if someone's only getting 3 hours here, an hour here, an hour there, sometimes they're not able to get adequate restorative sleep. So one sleep period is always ideal, but if catch-up sleep is all that you can do, I definitely feel more restored when I get catch-up sleep. So that's what I would speak to that question.
Absolutely, thank you. A participant question is, a side effect of my cancer treatment for head and neck cancer has been swelling, which I think is causing sleep apnea. How do I know if a CPAP machine is a good option for me?
Well, obviously anything that can be done to minimize that, and maybe there is nothing specific that can be done, but you would have to basically check and see if you're having sleep apnea because of swelling. That's not at all uncommon, whether it's from weight narrowing your airway, whether it's swelling narrowing your airway, that can be readily evaluated and treated temporarily until that situation is no longer the case for you.
Okay, thank you. When I try to fall asleep, it feels like my brain and mind do not want to shut down. Listening to all your good suggestions, which one is best for me?
I think the best thing is learning how to block your brain. And I'll be very open and honest here. I went through a difficult time for like 10 years where ding, 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 ding. I personally had to learn how to block my brain, or I swear I'd probably be dead right now, because you do have to get sleep. So literally I practice myself, the hour before bed. I block my brain. I just don't let stuff in, and I certainly don't let stuff in when I'm actually in my bed, because all it's doing is robbing me of sleep. I'm not actually acting on what I have to do tomorrow at work, or pay this bill, or get this at the grocery store, or worry about the kid or the grandkid, or whatever the issues are. You're not achieving anything. And once I think I really got that through my head, I just said, hey, this is my time. I am thinking my sleep thought, and I'm just gonna snuggle in my bed and go off into dreamland, and all that other stuff can wait until tomorrow. And it's practice. And once I said that when there's a problem with sleep, it's never going to be perfect. There are times I can't get a certain thing out of my head that I'm concerned about. So you're going to have bad nights, you're going to have good nights, but what we work toward is just a gradual improvement overall in your sleep quality. But it takes practice.
You need to learn how to do that. All right, tips for folks who work odd hours or night shift.
Well, I often say to my patients, if I were president, I would do away with shift work, period, because it's one of the worst things, in my opinion, for people's sleep hygiene and sleep quality. So shift work can be anything from a rotating shift every week, a rotating shift every month. I mean, all the companies do it kind of differently. And there's not a great answer for shift work. Now there is shift work disorder, that's one thing, but it's another thing if you're just acclimating to, to me, once a nighttime worker, you're never going to have the best normal, nighttime sleep if you've stayed up all night for, 20 years. That's just going to be very difficult, to achieve. But basically the same kinds of things, if you work nights and you come home and sleep during the day, you're supposed to wear sunglasses driving home so that you're not stimulated by a lot of light. You're supposed to keep everything dim, quiet, same bedroom rules, okay? And trying to do the best you can to minimize light as you're coming home from work. And then to stay up at work, if you're tired during your sleep shift, a lot of people do use, stimulant medications to get them through. And even sometimes at night, if you're a shift worker, sometimes your employer will let you take, small cat naps to improve your productivity during nighttime work. But it's just not a great situation.
Okay.
And in some people that really have a difficulty, I really try to encourage them to not do shift work.
Great advice. You have lots of questions here, so we're going to keep going. I've gotten into the habit of napping and I want to stop. What is a good plan to try and correct my sleep patterns? I know you said to do it gradually, but I'm one of those who need a plan to follow.
Okay, so napping is a problem, okay, but you can't nap if you don't sit or lay down. So what I try to do, and this is important for not just cancer patients, but let's say you have you're a caregiver, for say a person with dementia, and they're up at all hours and they're napping during the day, and it's just a kind of a miserable situation. So prevent napping during the day. I tell people, get up, get out, go to Walmart, go to Home Depot, force yourself to be up and out of the house so that you are not able to nap. And it takes, it's a struggle because you feel, oh gosh, I just want to take a nap. I'm personally not a napper, so I can't nap unless I have like 3 hours to go dive down deep. But a lot of people do nap. And when you do that, you take away your homeostatic need for sleep at night. So the only way to not nap is to force yourself to be active and be in a position where you cannot nap. And I tell people, they say, well, I fall asleep when I'm sitting down watching the TV. I said, well, don't sit down and watch the TV. Get up and go do something else where you're not able to physically do that. Obviously we don't want you driving if you're in that kind of situation, but you can force yourself to go out somewhere where you are not able to nap.
Great advice. All right. I have found that getting a good night's sleep has helped increase my appetite during treatment. Are these two linked, and can you explain why?
Yes, they are linked. So, and I had a slide that showed that your appetite is improved when you have adequate restorative sleep. Not only is your appetite improved, but the types of food you desire are improved. Okay. And yes, there is a connection. When people are sleep deprived for whatever the reason is, they're grumpy, their brain's not working, nothing is working in sync. And some people may eat more, some people may eat less, but definitely the quality of food that you desire to eat is better when you are have restorative sleep.
Okay. Do you know if melatonin is a safe option for cancer patients? Any suggestions on dosage or frequency of use?
Okay, so I did not actually look up melatonin per se for cancer patients. We know that probably 50% of people, 30 to 50% of people probably take some kind of sleep aid during the course of their situations. Melatonin tends to be one of the more common over-the-counter sleep aids that people take. I personally, that's the only sleep aid I've actually ever taken in my life. And I didn't think it did much for me, but some people really do. It is recommended that you go with the lower dosages, 3 milligrams, not more than 5 milligrams, if it helps you. But I have not specifically looked up research about melatonin and cancer.
Okay. I use soft music and a cool fan. I still have issues going to the bathroom as I drink a lot of water. Any tips to help me out?
So I have an overhead fan. I have at one point, for women, if they have menopausal things, or for men who are maybe on hormonal therapy for prostate cancer or whatnot, heat and being woken because of being hot is a very, very common thing, even for non-cancer patients. I at one time had an industrial fan right by my bed. I told you I have an air conditioner that's like set at 60 degrees in my window, a portable air conditioner thing. So cool is very, very important. I've even thought about getting a cooling blanket. I've thought about putting pillowcases in the freezer so that when I do wake up hot, I can put a pillowcase on, a cool pillowcase. So it's a difficult thing, that whole hot flash thing and getting heated. You do want your room to be cool. So that was that part. Ask that end of the question again.
That they use soft music and a cool fan, but they still have issues that they have to get up and go to the bathroom because they drink a lot of water.
That's right. Okay. So the drinking of water is something that you can control. Even if you have dry mouth or, some reason why you're drinking that much water or liquid, period, try to switch to a non-liquid form of hydrating your mouth, lozenges or other sprays that they have available. But drinking late into the evening is a real problem. And you will have to get up and go to the bathroom. Your body, when you're sleeping, your kidneys actually filter better because you're recumbent in sleep. So that fluid will go through your kidneys and you will have to go to the bathroom more frequently. So trying not to drink, say after 6 o'clock, ideally after 8, is something that you can control. Okay. And we try not to have people have liquid at their bedside because that just promotes them wanting to drink it. And then 2 hours later, they're up going to the bathroom. The soft music thing, I have a sound machine, and this happened when we had kids, forever ago. And the problem with all of those things that we build into trying to help us sleep, whether it's blackout drapes, eye mask, sound machines, your body quickly adjusts to that. And I didn't realize this was 25 years ago when I was still traveling for conferences and whatnot. And I'm in a hotel room, no kids, you know, all I have to do is sleep, and I could not go to sleep. And I finally realized it's because I don't have that stupid sound machine, you know. And then now I travel with a sound machine, but once you get used to certain things, your body is going to, you know, expect that. I mean, if I have an earplug fall out of my ear during sleep, I may not wake up right that minute, but my body's going to know that that's not there, and I'm going to wake up, and I won't be able to go back to sleep until my stars are aligned with everything that I have done to myself over the decades to try to help my sleep. So the music is not a bad idea. I would just advise against anything with deflections. You know, some people leave the TV on, or they listen to raindrops, or, you know, podcast, or different things like that. But I think that the deflection, the variation, once it stops, you know, it's going to wake the patient up, generally speaking. So if you are going to have any noise, it needs to be, or music, it needs to be kind of a steady, non-deflection type of noise.
Great tips. All right, we have a few more questions. Katie, do we have time for those?
We have time on our end if you guys are good.
Yep, we have a couple more questions. Somebody would like to know, what about the use of CBD gummies for sleep?
Okay, CBD, I've researched quite a bit about CBD because my son has psoriasis and joint problems and whatnot, and he uses CBD, and I know there's CBD for all different kinds of ailments. I personally have not tried CBD, but I hear positive things anecdotally, you know, from patients. So I think CBD is something that probably has very little downside, although I haven't really aggressively researched the downside of CBD. But I think that any individual person, regardless of why they're taking CBD, will know for their own selves whether that's helping them or not. The vast majority of people that I have interacted with, patients that is, you know, if it helps them, it helps them. And then if it doesn't, it doesn't. But, you know, for whatever purpose they're using it for, it might be for pain, it might be for sleep, it might be for appetite, it might be for other reasons.
Okay. All right. I have been diagnosed with obstructive sleep apnea, but I can't use a sleep app. What are my other options?
So obstructive sleep apnea, depending on the severity, depending on the patient's anatomy, their throat anatomy, upper airway anatomy, and depending on weight issues. We have 3 treatments, well, 4 treatments. If there's a weight issue, I aggressively work toward weight loss. As I do with all my patients, I'm aggressive about nutrition and weight management because that's another pillar of health. If there's not a weight issue, depending on the severity, dental devices there's many dental devices. I would recommend, if you opt for a dental device, you have to have a normal, you know, dental anatomy, no, you know, partials or dentures, things like that. You have to be able to hook the device to secure teeth. And I would go to a dentist that is certified in sleep dentistry. We use that only really for mild sleep apnea, not moderate or severe, although it can help moderate or severe sleep apnea. You're generally not going to do away with the problem completely, but it's certainly an option. Number 3, as many of you I'm sure have heard on the radio or advertisements now on TV with the round table and everybody talking about no CPAPs, and they're talking about Inspire, which basically is a pacemaker for the back of your tongue. There's a implanted kind of pacemaker device subcutaneously. A wire goes to the hypoglossal nerve and a wire goes to your thorax to sense when you take a breath. It stimulates the tongue to move forward, so it moves it out of the way so it doesn't obstruct. So there are, that's been on the market now somewhere between, I guess, 8 years, and it was studied for 10 years before that. So it's been on the market for quite a while. The physicians that perform that procedure are trained by the company. So it's not anyone can do it kind of thing. At least that's how it was a couple of years ago. Could have changed. I don't think so. But you have to be a candidate for that with a BMI less than 32 is how it was studied. Some ENTs will implant up to BMI of 34. You have to have an awake endoscopy to see exactly how your airway narrows, to see if you're a candidate. If it narrows circumferentially, which is all the way around, you generally don't tend to be a good candidate for that. So that's a procedure, you know, that has to be done to see if you're a candidate. And then of course it has to be approved by your insurance, which initially when it came on market was very difficult, but now almost all insurances will cover that. Originally, it was intended only for people who are completely intolerant of CPAP, and that generally is still the case. If that answers your question.
Yes. All right, 2 more questions and then we'll turn it back over to Katie. One is, hormone therapy has caused me to have hot flashes and night sweats. Are there any pillows or mattresses that offer cooling?
Yes, there are. And I can definitely speak to this question because at my age, I'm still having, you know, hot flashes, sometimes worse than others, but not as bad as originally, but still pretty bad. And that's why I had that, you know, industrial fan, you know, by my bed. And still now, I probably, some nights are pretty bad. It might be 20 times, it covers off, covers on. Because as soon as the covers go off, your sweat evaporates and then you're freezing. And so then the covers go on and it's like this all night long. So I can tell you as far as the cooling devices, I have bought cooling pillows at Costco. I've bought cooling sheets. I've bought cooling pajamas. I mean, you try to do everything you can to stay cool. And just recently, like I said, I was thinking about buying an industrial cooling blanket like we use for hyperthermia in the intensive care unit because you're so desperate just to, you know, not be so hot. So I'm still actively investigating those things. I have not tried a cooling mattress just because I don't think my husband would invest in it or allow me to invest in it, but haven't quite gone that route yet. But I am definitely thinking about getting those gel pillows that you can actually, you know, put in the freezer, keep them cold, and then have them cool. At least your head will be cool, and that tends to help your whole body, you know, with cooling. But it's a struggle. But there are definitely items out there. I don't want to endorse any one particular item, but there are items out there, and I think they help. I do think they help. I think depending on how bad your situation is, they may not, you know, fully do away with the problem.
Okay. One final question, Katie, and then we'll turn it back over to you. As a cancer patient receiving treatment, how do I know if a sleep study would benefit my sleep or if I should just wait and see if this is temporary?
Well, in a sleep study, we're specifically looking for certain things. Okay. We're looking for, is there obstruction? Okay. In the airway causing the patient to have fragmented sleep. So what happens when you have an obstructed airway? What happens is in deep sleep, our airway is surrounded by muscle. Okay. And in deep sleep, we lose muscle tone so that we don't act out in our dreams. So the airway can just close on itself. And you don't know that because you're sleeping generally. But your airway, your oxygen level will start to fall and your brain has checks and balances. So it will know that your oxygen level is falling and it will wake you up to a lighter stage of sleep so that your airway will open again. So the person with sleep apnea is just kind of having, you know, superficial sleep and not getting into good, deep restorative sleep. So that's one thing that we look for in a sleep study. But we also look for restless legs. Sometimes people with cancer may be anemic, they may be iron deficient, which contributes to a restless leg problem. They may have bruxism or grinding of their teeth that causes arousals. They maybe have arousals that are nonspecific related to pain issues that the patient may be having that are causing brain arousals. So we look for multiple things when we do an in-lab study. And I think that if your treatment is going to be, you know, for any length of time, or you have any of those symptoms, that it would be appropriate to pursue that now, get treatment for that now, because getting adequate restorative sleep is going to improve your tolerability and effectiveness of your immune system and of your treatment. So, you know, if you're finishing your treatment next month, probably not, but if it looks like this is going to be a treatment situation of some duration, or certainly if there's any obstructive symptoms, you would want to go ahead and get that evaluated.
All right, thank you so much. Katie?
Thank you both, Dr. Rossrucker and Stephanie. That was a lot of great information, a lot of great questions. So thank you everybody for submitting those. As we wrap up, I want to remind everyone, I know we've mentioned this several times throughout the program about mindfulness and seeking some stress reduction. We do encourage you to visit our website, cscatlanta.org. We do have a couple mindfulness classes that you can check out and see if they're right for you, and some stress reduction classes like yoga, gentle yoga, chair yoga. And a recording of today's event will also be on our website. You can visit that video tab, and I will put our website into the chat box for you to reference. So as we wrap up, I'm going to throw it back out to you both, Dr. Rossrucker and Stephanie, to share any final thoughts. Stephanie, you want to start us off?
Just thanks everybody for logging on. If you or anybody you know is having any issues sleeping, just please reach out to Dr. Rossrucker or one of our other physicians so we can get you taken care of.
And from my
thanks, Dr.
standpoint,
Rossrucker, for doing this.
Okay, sure. And from my standpoint, anyone who has joined during their lunch hour, I hope you had a delicious, nutritious lunch while you were listening to the presentation. Hope you gained some kind of knowledge from it. And just a quick plug for all of the Northside sleep physicians. We all know each other, we all work together. And I have to say, I'm very pleased and happy and thankful to be with such a wonderful group of sleep physicians. So I think whoever you work out or reach out to evaluate a sleep issue, you'll be very happy.
And thank you, Katie, for inviting us to do this time.
Yeah, thank you guys, and thank you, Dr. Rossrucker, for coming
Bye,
back.
everybody.
All right, bye,
Bye.
everyone. Take care. Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.